As part of our series on interpreting lab tests, I wanted to just briefly look at some of the thyroid lab tests that can be done. Now, not all of these thyroid tests are done, but I've listed basically 4 of them here: the TSH, the T4, the T3, and the reverse T3. Each of these has different functions, and you can refer to this diagram and you can kind of see a bit about what their functions are. But right now, I'd just simply like to discuss normal ranges versus optimal ranges. Normal ranges are derived through a scientific method of testing a bunch of people for the lab test result and then making sure you're not having people that have the disease as part of the test group. Unfortunately, in many cases, people with subtle disease are included in the test group. And so then people with the disease are actually included in the normal range. Over time, we learn that the normal range is not actually the optimal range. And ultimately, it would be good for us to actually relist the optimal range instead of the normal range. But like anything else in the world, changes like that are often very slow. So looking at the TSH, the thyroid stimulating hormone, which is the most commonly performed thyroid test, the normal range is about 0.45 to 4.5, but the optimal range is at the bottom of that, or even a little bit below. So 0.3 to 1.5. T4, which is an inactive thyroid hormone, has a normal range of about 0.8 to 1.8, but its optimal range is actually at the upper part of its range, or about 1.4 to 1.8. The T3 is the active form of thyroid hormone, and its normal range is about 2 to 4.4. But once again, the optimal range is in the upper part of that range at 3.2 to 4.4. The reverse T3 is an inactivated form. Now, T4 is inactive in the first place, but shunting to reverse T3 keeps it inactive. And so that suggests that you would want this to be a little lower, because if you have too much reverse T3, it's going to get in the way of thyroid function. But this is a helpful test, or a helpful function, because if it can shunt too much T4 away, it can protect you from inadvertently making too much T3. But the normal range for this is usually around 9 to 25. But typically in healthy people, we'd like to have it lower so that you're not throwing away too much thyroid hormone into reverse T3. So less than 15 or so is probably a pretty good level to look for. Now, most of the time, not all of these tests will be done. Sometimes just 1 or maybe 2, but you can talk more with your healthcare provider about what to do and how to interpret these, and this diagram may be of some benefit in that discussion. Thank you for your attention to this brief overview. I have a more detailed version of this in our learning modules, and then there's another learning module called Endocrine Conditions that gives kind of an overview of thyroid function, and we'd encourage you to look into those things as well. Thank you very much.